Saving a life, what they didn't teach me in school about living kidney donation. This is Glenna Fry. I'm an advanced practice RN, clinical nurse specialist, and nephrology nurse. And I'm here today to share some information that I didn't learn when I was going to school about how to save a life through living kidney donation. Before we start, I would like you to do something really important and take this pre-presentation survey. So you will see this link in the bottom of the video, and you can go ahead and click on that and pause the video while you take the survey. And then when you return, come back, press play, and resume the presentation. This will help us to understand people's attitudes toward kidney donation. And there will also be a post-presentation survey at the end. And when you complete both, it provides the most value for analyzing the results and how helpful presentations like this can be for people like you. So you can go ahead, if you haven't already, and pause the video and then come back. As we begin, I'd like you to close your eyes if you're in a space that you can comfortably do this. And just kind of settle down and relax in your chair. Take a deep breath in through your nose and out through your mouth. Now imagine that you are allowed to have a wellness check with your primary care physician, and you're sitting on the exam table in the cold, sterile room with a loosely tied gown and freezing. And after the physical exam, they're reviewing your blood work. And oddly enough, you have an elevated BUN and creatinine and a low glomerular filtration rate, or GFR. And they're saying that you could possibly be in stage 3 of chronic kidney disease. How do you feel about that? And what does that really mean to you? Do you know anyone else personally with kidney disease? Have you ever taken care of anyone with kidney disease or on dialysis? Your mind races to a dim future. What if you progress to stage 5? What treatment would you choose? Hemodialysis? Peritoneal dialysis? Kidney transplant? What questions do you have? And what information do you need to explore? And what is your overall impression of how this will affect your life, your job, school, your family, and your future? Now take another deep breath in and out, and maybe wiggle your fingers and toes and gently open your eyes to return to the room. And just notice how you feel about the idea of having kidney disease. So what exactly do those stages mean that I talked about? And when do you need to plan for some type of treatment? Here are the 5 stages of chronic kidney disease with the GFR and the percent of kidney function. And so it just briefly goes from stage 1, which is normal function with good percent. And then as the stage increases, when you get to stage 4, for example, you've got severe loss of function in only about 30% to 15% kidney function. And stage 5 is kidney failure with less than 15% function. So stage 4 is really when you should have a specific plan for treatment. And really, anytime before stage 5 is good. Unfortunately, many people end up in the hospital and on hemodialysis without any conscious decision-making about what they were planning to do if they reach stage 5. So it's important to know your lab results, the trending, and talk to your nephrologist about the progression way before stage 5, if possible. As you consider the option of hemodialysis, you will need a vascular access surgery several months before starting. Planning ahead will more likely get you a fistula, which is better, with less infections and problems. Without planning, you'll get a central line. And then think about what type of dialysis you might choose. In center, which is 3 times a week for about 4 hours. You will have improved outcomes and survival if you choose home. You might need a partner if you do that. There's also daily, which could be around 6 times a week. And nocturnal, which is a little slower, longer, more like 8 hours, 3 or more times a week. And that could be done home or in center. So what does your dialysis center offer? And what are the benefits of each? And what is best for your lifestyle? And where would you go if your center didn't offer the one that you preferred? How do you think you would feel being on hemodialysis? Or you might choose peritoneal dialysis. You will need a catheter. Typically, that's placed surgically and several months in advance so that it can heal before you actually start the treatment. Training is in center, and then often people can go back to home and do the treatment. This is a couple different types. You can do them daily, and basically the solution goes in by gravity into the peritoneal cavity where this fluid sits as it cleans the blood, and then the waste from the fluid goes out into another bag. This can be done 4 times a day. Another option is to use a cycler machine at night, hopefully while you're sleeping. The solution is warmed and it cycles in and out. There's lots of variation on the number of times of day, the types of solution. And you also need some space in your home to store the supplies because you get about a month's supply at a time delivered. In 2019, President Trump signed the executive order called Advancing American Kidney Health. And one of those initiatives was to increase the number of people doing home hemodialysis, either hemo or PD, and less in-center dialysis. And with the coronavirus, we might be seeing more training for home therapy in the future. This is Bob. He told me the story, and even as a dialysis nurse, it surprised me. He was progressing in his kidney disease, and about 2 to 3 years before starting dialysis, he felt tired, nauseous, exhausted all the time, foggy, and could not think straight. And this was 2 to 3 years before stage 5. And he got no relief from symptoms with starting dialysis. He feels like he would be dead now if he had not gotten a kidney transplant over 19 years ago. And he's probably right. There are 2 major problems with going on dialysis. You have a shortened lifespan. The average life expectancy is about 5 to 10 years, and your quality of life goes down. If you started dialysis in 2020, you may not be here to see 2025. So what would you want to do with the next and possibly last 5 years of your life? And dialysis is expensive. And this is your insurance and tax money. We are all paying for everyone with chronic kidney disease. Hemodialysis costs around $90,000 a year. And kidney transplant is around $32,000 the first year and about $25,000 each year after that. But you can see the cost is much less than if someone was on dialysis. So what makes the most sense to you? Spending your money on hemodialysis treatments or kidney transplant surgery and medications? Do you think you would thrive on dialysis? Most nurses tell me that only 10 to 20% of their patients are thriving. They're working, active, independent, driving. And the other 80 to 90% is kind of like a slow death that we don't talk about. If you're approaching or are in stage 5 CKD, there are 2 other options. One is deciding not to have treatment, in which you would get hospice for end-of-life support, and then kidney transplant, which means you would probably feel better and live longer. Not everyone on dialysis is healthy enough to get a kidney transplant or even desires one. But what if we started talking about transplant in stage 3 or 4 instead of waiting until they were on dialysis and very sick? Would you prefer a healthy kidney? Well, there is a problem even if you want a kidney transplant: the chance of actually getting one. So let's say you get worked up and you're put on a list with 95,000 other people. This image only represents 200 of those people. And notice that only 22, those in the orange, will actually get a kidney. Which one do you think you are? And that converts to only 1 in 5 people on the transplant list will receive a kidney. So that means the other 4 will what? Go on dialysis, stay on dialysis, and eventually die on dialysis. This graph represents all organ transplants. Notice the gap between the number of donors in this yellow-green area are donors, and this is the waiting list in pink. Pretty big gap. These in blue are the number of transplants. So remember, this isn't just kidneys. This is, if you have a deceased donor, you're going to have 2 lungs, 2 kidneys, liver, heart, etc. So the number of transplants are larger than the number of actual donors. So the solution to this gap is simple: just register more people to become an organ donor, right? Organ procurement organizations are federally funded to provide education to the public about organ donation. They want you to register to donate your organs when you die, and that's great. About half the population currently register in the United States. Unfortunately, less than 1% will ever donate. And this is called deceased donation, registering to be an organ donor when you die. But what if we doubled the number of registered donors to 100% of the population? Doubled this blue area. Guess what? We're still not going to meet the demand. And why not? Well, there's 3 main reasons. 1, you need to be healthy. Your organs must be healthy enough to give to someone else who needs them. 2, the way you die. Typically, organ donors are in an intensive care unit, on a ventilator, and considered brain dead. That's often an auto accident or a drug overdose. I don't know how many people you know in your lifetime so far that have died this way, and family has donated their organs at death. I don't actually know anyone personally in my, friends and family that someone has died in this fashion. And the last is the family must give consent. Many hospitals will not take someone's organs without family consent, even though legally they could. And you're not talking, remember, you're brain dead on a ventilator. So it's up to your next of kin to say yes to donation. There are some other issues related to organ discards that might be improved, and OPOs are currently looking at those policies. So why should you care about being on dialysis or the kind of kidney you get? Well, dialysis is okay. You can live 5 to 10 years. Kidney transplant, though, is better. A deceased donor kidney, it'll last 10 to 15 years longer than on dialysis. And people will live 10 to 15 years longer with a deceased kidney, and it lasts 8 to 12 years. And there's a wait time if you want a deceased donor. The kidney transplant, though, is best if it's preemptive, which means you get a kidney before going on dialysis. And people typically live longer if they never have to start dialysis. It does last about 12 to 20 years, which is almost twice as long as a deceased, and there is less wait time. A kidney provides a better quality of life, more free time, more stable blood pressure and electrolyte levels, and higher rates of employment. Now, most people attempt to find kidneys for those on the transplant waiting list through, like I mentioned, registering to be an organ donor after death, or through the recipient, such as the Big Ask Big Give through National Kidney Foundation. Asking people you know to be a kidney donor is very difficult. Sometimes having advocates for you can help, but you're still looking at your close circle of family and friends. So is there another way? Well, we believe to find enough kidneys for everyone, we must also discover living donors from the general public. And that means kind of talking to anyone who will listen about living organ donation. Have you previously heard of many presentations about living kidney donors? If you're like me and most people, it's rare to hear anyone formally speak about living kidney donation and what it involves. Even as a nephrology nurse over 30 years, I've done hemo, peritoneal, kidney transplants. There were no presentations about being a living kidney donor. My husband, his family, and my daughter have polycystic kidney disease, and that means many of them have been on dialysis and have received kidney transplants. And still, even then, no formal presentations dedicated to learning about the details of being a living kidney donor. I know what you're thinking. Yep, I'm a boomer. That are a long time ago. They didn't teach me about this in school. And that was a long time ago. But I'm guessing that you're smarter than I was, and you have a greater chance of making this world a better place to live. And we need more acts of kindness. And people do have the ability to save a life. So let's erase that story about having kidney disease. And I'm going to have you close your eyes again and settle comfortably into your chair. Take another deep breath in through your nose and out through your mouth, and just relax and pretend like you no longer have kidney disease. You're healthy. Imagine you are on your iPhone looking at YouTube videos and you watch a TED Talk about living kidney donation. And later that day, you can't get the idea of donating a kidney out of your head. You're curious about whether you might be able to donate, but it's still a pretty scary thought. So how do you feel? What does that mean to you? Do you know anyone on the transplant waiting list that needs a kidney? And do you know anyone who has actually donated a kidney? What questions do you have? What information would you need? And where would you go to get the answers? And what's your overall impression of how this would affect your job, school, your family, and your future? And what will your family and friends think about you donating? So take another deep breath in and out and come back to the room. But how do you feel deep inside about the idea of donating your kidney? As you consider the idea, there are 8 living kidney donor stages you will go through on your journey. So let's go through those one by one. Stage 1, the idea is sparked. For you, that was the TED Talk, but it could be talking to a donor, listening to a podcast, hearing about someone who needs a kidney. So somehow you hear about the concept of donating a kidney while alive, and this plants a little seed. That seed or idea could be dormant for years or start to grow quickly. You may see a poster at work. This was made by Mark's family after a discussion with Kidney Donor Conversations. His wife gave him his first kidney, and he was on hemo working full time. Unfortunately, he died shortly after receiving a deceased kidney. This is Jim, who posted his story on Facebook after encouragement by Kidney Donor Conversations. He had several people come forward that did not work out. and he received a deceased donor kidney and is doing well. Or you might see a billboard. Harvey Meisel with Living Kidney Donor Network can actually help you make this and post it online. It's not actually a real billboard, it's an online billboard. Next is stage 2, quiet thinking. You don't tell anyone you're considering donating. You have to be sure this is right for you. It's just your own little secret right now. You're just quietly thinking about it. At some point in time, you have the desire to actively explore information about donating. And now we're in stage 3. You start to do some research on the internet. Maybe you tell your best friend, but no one else. And this is what you learn. You can lead a healthy life with one kidney. Some people are born with one and don't even know it. For those of you that like numbers, the risk of death in surgery for a kidney donor is 0.03%. That is the same for childbirth. And actually, gallbladder surgery is higher at 0.18%. And the risk of end-stage kidney disease after 5 years is on average 0.27%. And there is actually a risk index calculator that you can put your very specific numbers in and find out what your own personal risk is. And you also go to the top of the kidney transplant list if you need a kidney after you've donated. But first, for the workup, you're going to go through extensive medical testing. And it could actually identify some unknown medical problems. Are there any benefits to donating? Well, they're considered more from an emotional perspective, but people do find that pieces often seem to fall into place for those that want to donate. Most donors say they have a boost in self-esteem, they have an increased sense of well-being, improved relationship with the recipient, and almost every donor says they would do it again if they could. So another type of donation is directed, and this is donating your kidney to someone you already know. But let's say you want to donate to a certain person, but you earned a match. Paired exchange became available in the United States around the year 2000. And this is how it works. So let's say you want to donate your kidney and your person and you are not compatible. There are other people like you that aren't compatible, and they put all of you in a computer system. And what they find is that you match this recipient and this donor matches your person. And so 2 people end up getting kidneys. For people looking for a kidney donor, they don't need to worry about the blood type since there are these paired exchange programs available. They really just need a willing donor. So what if you decide to donate your kidney to a stranger? Meaning you don't really care who gets your kidney. You just want to help someone, anyone. This is called non-directed donation. Other terms you might hear are altruistic or good Samaritan. You help the most people this way because you can start a chain. So let's look more closely at what a chain is. So if you remember, we talked about having these people who are incompatible that don't match in a computer program. So they put all of them in, and they do find that donor 1 is a match with recipient 2, and donor 2 is a match with recipient 3. But the problem is donor 1 is not going to give up their kidney until their other person, their friend or family member gets a kidney. So that's where you come in. So you want to give just to anyone. And when you go into the computer program, they find that you are a match with recipient 1. So once you donate and are matched, then Donor one is agreeable to proceed, and everyone else now gets a kidney. And again, it benefits the most number of people on the waiting list. There is also something called an advanced donation. So let's say that you have a sister that you would like to give a kidney to, but they're not in stage 5 kidney disease yet. So they don't need it right now. So instead, you decide to donate your kidney to a stranger. And in return, your sister gets a voucher, a kind of like a coupon for a kidney. And later in time, she can use that voucher, and another non-directed donor, when they put them in the computer system, they find they're a match, and she will then get a kidney. In stage 3 of our living donor stages, you find that living kidney donors actually also live longer than the general population. Not because they donated, but because they're so healthy. Remember, I mentioned that you have to go through extensive testing to be sure of that. You also found an excellent, easy to read book for you and your family to help everyone understand the donation process better. The Kidney Donor's Journey, 100 Questions I Asked Before Donating My Kidney, was written by Ari Sittner, and it is available on Amazon. Are your family and friends supportive of your donation? Well, maybe this book could help both you and them understand the process better. So stage 4, you decide to start the workup. But what even is the first step? Well, you could take an online questionnaire, health screening questionnaire. You can do this privately, online, in the comfort of your home. And again, you don't really even have to tell anyone you're doing it. Many of these can be found on a transplant center's website. And Kidney Donor Conversations also has on their homepage at www.mykdc.org a link to click that will take you to the National Kidney Registry Health Questionnaire. Once you pass the health screening, they will send you blood and urine tests as the next step that you can take to your local lab. Stage 5 is the full workup. So after passing those initial tests, you will now need to choose a specific hospital or go to the hospital that your intended recipient is at. Typically, you might be telling more people about your plan to donate by now. Your full workup will look something like this. Lots of blood. Remember, they're going to do blood type, tissue typing, electrolytes, CBC, liver function, diabetes testing, which means a fasting blood glucose, oral glucose tolerance test, hemoglobin A1C, blood pressure monitoring. They'll probably do a 24-hour ambulatory monitoring. They want to make sure your blood pressure is less than 140/90, and you can actually be on one blood pressure med typically. And maybe you have a support dog to help you along the way. Kidney function, you might have a CT or an MRI. They want to make sure there is no blood or protein in your urine. They're going to look at your glomerular filtration rate, and that means you're going to need to do some urine collection. And a 24-hour urine is done probably more than once. So that means, especially for women, you're going to be peeing in this hat. And then you're going to pour that into this container. And then you're going to put that into a refrigerator. And you might have to do some planning ahead because it can be a little awkward if you're at work. You may not want your urine with your food. But it can be just a little stressful, and it might be easier to do that when you're off. You'll be tested for heart function, EKG, echocardiogram. You might have a cardiology consult. They'll check for high lipids in your blood. And if your blood looks like this, that could be a problem. They'll look for infections: HIV, hepatitis C, Hep B, tuberculosis, COVID-19. And cancer screening will be normal for your age and sex. Could be a mammogram, colonoscopy. You might need to see a dermatologist. And pregnancy. You can't be pregnant when you donate your kidney, and they typically will recommend waiting 1 year after surgery if you want to get pregnant later. You will meet with the team for your psychosocial evaluation. Could be a social worker, a psychologist, and they will ask you questions like, why do you want to donate? What does your family think? Who's your support? Who will help you after surgery? What if the kidney doesn't work? What if the recipient dies? Probably ask you some things you've probably never really thought about. And then the wait. During and after the workup, waiting can be one of the hardest parts. It can feel like time is locked, waiting for the test results, waiting for the transplant team meeting, waiting for the coordinator to call you back. But you eventually finally get the phone call and you are pretty elated. You burst with excitement when you finally found out you've been accepted to donate your kidney. And the fear, oh yes, there's also the fear of all of this becoming very, very real. And it's been a crazy road that you have finally achieved your destination, a surgery date. You have a pre-op visit 1 week before, hopefully a bowel prep the night before. It's a good idea because lots of people have really difficulty with their first bowel movement after surgery, and a lot of gas after surgery is one of the biggest complaints. You will only be able to donate if both your transplant team and you say yes, and you can back out up to the point of anesthesia in the surgery room. But for now, you choose to move forward and your kidney is removed. You've now entered stage 6. Your precious kidney is taken to your recipient and it immediately starts working. And you wake up and find yourself with incisions, an IV, oxygen, a Foley, a CA pump with IV pain medication, a heating pad for comfort, and the stool softener. The first day, you slowly get out of bed and take a few steps and sit in a chair. Stage 7 is recovery. On day 2, everything is disconnected. You are moved to pain pills instead of IVs. You're eating, walking in the hall, and possibly discharged if all is going well. Within 1 week, you will likely only need over-the-counter pain medication like acetaminophen, no driving for about 2 weeks, and back to work 4 to 6 weeks. This is Charlie the Unicorn. If you're not familiar with him, you can check him out on YouTube. The last stage is 8, your future life after donation. Some people like to talk about donating and others don't. Many describe donation as a non-event. It is such a small aspect of your life, having surgery and then feeling normal, that you soon forget about it. Some people do have minor complications, and those are being tracked, and the transplant center will address those if you have any. Follow-up visits are typically around 6 weeks, 6 months, 1 year, and 2 years. And here are a couple success stories to share. Bob looks dramatically better after only 4 days after receiving his healthy kidney. This was back in 2020. He says he couldn't think clearly, or he could now think clearly, and was more alert and had more energy. And Melanie, she was 20 at the time when she donated. She has since had 3 successful pregnancies and still has 1 healthy kidney. This is Bob about 15 years later. This is me beside him about 1 month after donating my kidney to a stranger. And I have enough voucher now for Amanda who has polycystic kidney disease, currently with normal kidney function, and my son Sawyer, and we don't know if he has kidney disease or not. This is Evie and her husband Doug. Doug is now off dialysis after getting a kidney from Patty, and this was about a month after their surgery in March of 2019. So now that you understand the basic process of living kidney donation, I would like to introduce you to the kidney donor continuum. So how do you feel about kidney donation in general? So it starts at this lower end with no, never, I would never donate my kidney. And maybe you're not able to give for some reason. Maybe you would give only if you're dead. Maybe you give only to a specific person or a family or friend, or maybe an acquaintance or a stranger. Or maybe you're ready to start the workup, or maybe you are a living donor. So think about where you are on this scale. And again, underneath the video, you'll find another link. And you can pause the video now, go to the link, and take this quick survey to identify where you are on the continuum. And this, again, helps us to understand more about people's desire to donate a kidney. After you're done, you can come back and press play and resume the presentation. Other organizations attempt to find kidneys for people on the transplant waiting list through the recipient or registering to be an organ donor. But to find enough kidneys for everyone, we must also discover living donors from the general public. And that's why my daughter Amanda and I started Kidney Donor Conversations, to provide education and support about living kidney donation. In summary, you've explored what to do when faced with chronic kidney disease, the stages, treatment options, and the benefits of a living kidney donor transplant. You've also learned about the 8 stages of living kidney donation and how to save a life. How will this change the way you care for patients, talk to others about organ donation, and the impact you will have on making this world a better place to live? You can reach us at mykdc.org or email at info@mykdc.org. It's been an honor to share this information with you. And now it's time to take that post-presentation survey. It includes an evaluation of the presentation, and we really want your honest feedback on what you liked or how we could make this better. And when, again, you complete both the pre and the post surveys, it provides the most value for helping us understand attitudes toward kidney donation and helping others. This is also the end of the presentation, so you may take the post presentation survey now. And again, the survey link is below this video. Share the video and information learned to help discover more living kidney donors and help save a life.